In specific to lung cancer, Lee, it's there are the main thing that what the presentation usually is that if you've had a cough for 3 weeks or more, and if it isn't COVID, it could be a warning sign. And I think that's one of the key things that I want to kind of mention there. There are many other symptoms, but this is the predominant one. And obviously, given the fact that COVID is there, a lot of people may just confuse that this is just to be with that, and if it isn't the other thing. Cough for more than 3 weeks, and if you've checked out that you don't have COVID, that would be the key thing that I would tell your listeners. The along with that, there are other symptoms as well that your listeners may want to keep an eye on. Is that if you've had chest infections that keeps coming back, or you may be coughing up blood, or a long-standing cough that has suddenly got worse. It could be an ache or a pain when breathing or coughing. It could be a persistent breathlessness, persistent tiredness or lack of energy, loss of appetite or unexplained weight loss. Early diagnosis and treatment of cancers can definitely save lives. So, any of these symptoms, uh, please do get in touch with your GP. More often than not, this could probably be nothing serious, but what is important here is that finding cancers early makes it more treatable. So that's the key thing that I want to kind of mention here, Lee.
Yeah, it's very important, isn't it? So I know a lot of people might be worried about going to the doctors in a time like this or things like that. What is the system that you go through once you ring the doctors and they'll refer you to a specialist?
Yeah. So I mean, it's completely understandable the fears that the people have had, not only going to the doctors or going to any place, even probably going to the supermarket or any other place. But one thing, what the practices and the NHS services, whether it is the hospital or any other place, everyone have adapted to these new ways of making sure that we look after patients safely. So, for example, NHS uh, specifically to cancer, the NHS staff have worked on re-establishing COVID secure cancer hubs and consolidating cancer surgery. They're prioritizing people for surgery based on the clinical need. But at the same time, even in the practices as well, where that will probably be the first port of contact for the patients with any of these symptoms, that they reach out to their GP. I think that is the main thing that I would ask. And once the GPs are contacted, they would go through your symptoms. They would do any necessary investigations and do a referral if that is appropriate at that time. I'm hoping that this message reaches not only to your listeners but also to your listeners. It could not be your listener directly, but it could be their friends, or it could be their loved ones, or it could be their family members. So if the other thing that I want to also say is that if either your friend or a family member has been coughing for 3 or more weeks or more, and if it isn't COVID, as I said before, please encourage them to contact the GP practice.